All right, this is a video of Rick Olderman. He is easily one of the best therapists, physical therapists we know. He's a real master clinician.
Right, he's been treating patients for about 25 years, if I do the math right.
Right.
And he teaches patients to take care of themselves.
The root problem.
Yeah, it's what people are looking for when it regards to.
So, yeah,
us.
I'm sorry, Ben.
Don't
In this
worry about
video, he's working with a real patient whose low back pain is caused by spinal stenosis.
Right, which is pretty common.
So he gives her 6 exercises that help give her some immediate relief.
All right, we better let Rick take over.
Yeah, take over, Rick.
Bob and Brad, the two most famous physical therapists on the internet.
Catherine, why don't you tell me a little bit about your back pain?
So it starts in my lumbar spine at the bottom there, and then it just it's a pain that shoots equally down both legs, and it goes all the way down to my ankles, and it just kind of feels like I stepped on a live wire.
Okay, and when does this happen?
It happens in the morning when I get up. That's the only predictable time it happens. It'll happen at odd times during the day, but like when I get up from sitting and get up from bed, I know I can be prepared, but then sometimes it just does it on its own.
Am I right? Did you have an MRI or X-ray of your back recently? Was there something that showed up there, stenosis or something?
Yes, that's right. I did, because I sent you the report, and yes, it shows a narrowing. I guess you call it stenosis.
And do you remember the level? I think it was it L4 or L5 or?
I know, it was L3, L4.
Okay.
Being
All right.
compromised.
Yeah. So diagnoses of stenosis, there's varying degrees of stenosis. It doesn't worry me. We help people even with severe stenosis.
Oh, that's good to know.
So what really matters is the stresses that are acting on that stenosis. So that's what we're going to be hopefully solving today.
Yeah.
All right, so the first thing that we're going to be doing, Catherine, one of the things with especially stenosis, but most back pain, is that we get spasm in the back and the muscles just get really irritated and stuck in contraction.
Okay.
So what I'm going to just have you do is I want you to arch your back, and you'll feel those muscles contract.
Yeah.
And then I want you to learn how to relax your back and round into like a slumped position. And you can rest your weight on your hands if you want to. Good, and feel that. And this should feel really good just to slump like that. It should feel like a nice stretch.
It does. It feels very good.
Good. Okay, and then we're going to do it again. We're going to inhale and arch your back and go as deep as you want to. And then exhale and flatten your back and rest on your hands. All right, and then we're going to come back up, and this time when you sit up tall, we're not going to arch the back quite as much. So we're going to keep it out of that excessive contraction.
Okay.
How does that feel? Does that feel like a good thing to do?
Yeah, it does. It does.
Great. It's an easy thing that you can do throughout the day. Anytime your back starts to feel like it's starting to seize up or get contracted, just go into that. You're going to release that reflexive contraction and then relax them again.
Oh, okay.
So the first exercise we're going to do is just have you get up on the table, and I'm going to lower this down a little bit for you. Good. So all we're going to do is I'm going to have you just kind of lean forward into that, and you'll feel a little bit of a hamstring stretch.
do.
Now, if you want to, you can pull the toes back, and you'll feel more stretch in your calf too.
Indeed, I really do.
Okay, so we want to be gentle with this one because you've got sciatic nerve symptoms running down your leg. That's what all that lightning bolt kind of action is. And we don't want to irritate it. So we just want to gently stretch that nerve a little bit and the muscles surrounding it by doing this one. And we'll just hold here for a few seconds and breathe.
This is it?
This is it. Yeah, it's this simple.
Oh, wow.
Yeah, so you're just going to breathe through that little gentle stretch, and then we're going to go ahead and turn around and stretch your other leg too.
Okay. Oh, that's interesting. I feel it way more on one side than the other.
Yes, and that's why I was asking you about whether you felt it in both legs the same, because often there's an asymmetry to how we're using our body that causes one side to be tighter than the other, and that lends itself to creating these types of problems.
Okay.
So, and we often start feeling that asymmetry once we start addressing
Yeah,
the
interesting.
system.
Okay.
All right. All right, Catherine, what we're going to do now is a little hip strengthening exercise. So often when the hips get weak, they create asymmetry in the pelvis and the back. And we want to make everything nice and symmetrical for you. Okay?
Yes. Yes.
And especially if you like hiking and walking
Yes.
outdoors, hip
Yes.
strength is really critical.
Okay.
All you're going to do is you're going to move that other leg out and in 15 times. Pretty interesting, isn't
Yeah,
it?
it's very interesting.
Yeah. And so these little asymmetries sneak into our body and we're not aware of them.
Yeah.
You're a pretty fit person and you're unaware of these things happening.
Yeah.
And so this lends itself to one side of the body being used a little bit more than the other, undergoing a little bit more stress than the other,
Good. Okay.
you know, all that kind of stuff. What we're looking for is maybe a little fatigue in the hips here. Do you feel any fatigue from doing that?
I do.
Okay.
Uh-huh.
Okay, great.
Yeah.
All right, great. So we'll move on to the next one. You can stay right
Okay.
there. Okay. So we're going to lie on your back with your knees towards your chest. Now this should feel really good for your low back.
It does.
Okay.
Yes.
Do you ever do this on your own just to relieve your pain?
This is what I
Okay, so that's your body telling you, hey, I want more of this, right? And so one of the reasons this isn't happening is because of the tightness in the front of your thighs here. So we're going to stretch those out a little bit.
Okay.
And by the way, when you do this stretch, you'll notice that if I take this pillow away from your head,
Yeah.
your back wants to arch more.
Yes, it does.
And when we lift up the head,
Yeah.
it makes it flatten
Yeah,
more.
yeah.
So this is a good thing to do at
Okay.
home.
Okay.
Okay. So all you're going to do is, let's hold on to your left knee first.
Okay, like this?
Yep. And then you're going to lower that other leg down.
Okay.
And you want to keep this knee bent at 90 degrees.
90. Oh,
And you'll feel that stretch right here.
I do.
Good. That's all we're doing is stretching it. So no magic here. And then yes, pull back on this knee to keep your back nice and flat.
Yes.
This knee will want to tend to travel forward.
Yes.
And then your back will start to arch. And if that happens, you'll get up from the stretch with some back pain. We don't want that. We're
Okay.
trying to go the other direction,
Okay.
right?
Okay.
So if you can't bend your knee at 90 degrees, you can bend it wherever you want, all right?
Okay.
Whatever's comfortable for you, but 90 degrees is where we want.
Am I at 90 degrees?
Yes, you're pretty close there. And then also we want this leg ultimately to be able to rest on the table. But if
Okay.
it's off the table in the beginning, that's
Yeah.
perfectly fine.
Yeah.
You
It's
know,
off
just-
the table right now.
just take your
That
time
gives
and-
me something to work with.
Exactly. All right. So generally about a minute here. Is this feeling okay? This should not increase any pain while you're doing this. In
No,
fact, it should
doesn't.
feel good.
It does feel good.
Okay, great. Okay, so this next one, Catherine, we're going to have you just, we'll pretend like this is your kitchen countertop.
Okay.
And we're just going to lean on it and we're going to lift one leg with the knee bent. And you're going to lift that up and you'll feel your butt engage here at the top there. And I just want you to do a nice little pulse at the top there and feel that the butt is contracting to do that.
Should my standing leg be straight?
I would like it to be slightly bent,
Okay.
if you can do that.
Yeah, because that feels a lot better.
Good. So ultimately, the arching of your back is what's causing your back pain. The more you bend the stance knee, the less arching your back will go through.
Very good.
All right.
Okay, that makes sense.
So we're going to do about 30 of those, and then we're going to hit the other leg. So let's go ahead and switch. Okay.
And so what is this actually doing?
Well, a lot of back pain is caused from hip dysfunction.
Oh,
All right. And so what we're doing is correcting the most likely cause of your hip dysfunction
okay.
with this exercise,
Okay.
which then is contributing to strain in the back.
Okay.
All right.
30 times.
30
Each
times.
side.
Yep.
Okay.
Okay. And then you can stand up.
Okay.
All right.
Everything just feels a little more loose.
Yeah. I love how you just figured that out.
Yeah.
You know, you just listen to your body, and that's what it's really all about.
Yeah.
I love that. That's
So-
exactly what you should be doing.
Okay.
All right, so what we're doing is just turning on some key muscles, turning off some others,
Oh, good.
and taking stress off of that stenosis in your back and the other areas that are
Well, thank you.
under siege.
Thank you. Thank you so much.
All right, so how does that feel?
Yeah, so it just, I mean, it feels like, it feels so refreshing that I can't wait to do it. It encourages me to want to continue to
Yeah.
do these exercises.
Good. It's really that simple.
Yeah.
It's
I'm
not hard.
surprised. I thought
It's
it was
just
gonna be
Yeah.
It would be hard.
Yeah, it's not aggressive, it's gentle. Hopefully you don't feel winded or strained in any way.
No.
Great, great. And that's the key.
Oh, I'm pleased. Thank you.
Great. Oh, my pleasure. Thanks for coming. All right.